What about solutions on the continent? What is happening in Madagascar with COVID organics? The Africa CDC has not really supported this initiative. What is the position of the centers with regards to local solution and particularly traditional medicine, given that it's part of Africa's culture, Africa's tradition?
As Africa CDC, we encourage innovation. Indeed, we know that there is capacity for innovation in Africa, and we are encouraging governments to provide the required environment for innovators to come up with possible solutions. So in the case of Madagascar, we are in touch with the government there, and we are going to look at their data, and also we are going to facilitate multi-center trials so that their results can be reproducible. Whatever we come up with, we are going to make public. At the moment, we are still studying that information, and there is no decision that has been made by Africa CDC yet.
Let's talk about vaccines. Some people feel like Africans are being taken as guinea pigs, especially in this case where there was a controversy with some French researchers. Clinical trials, we know, are essentials in vaccine and treatment development. So how do you regain the trust of communities who are skeptical while ensuring that they are protected in this process?
I think it is important first to condemn in the strongest possible terms those who were recorded and documented to be speaking negatively about Africans in as far as clinical trials are concerned. They do not meet the threshold of scientists, because scientists do not speak like that. Secondly, is that all clinical trials that are being done in Africa and we are supporting are meeting the gold standard of doing a clinical trial. They are not only being done in Africa. Each and every one of the clinical trials that are being done in Africa are multi-center based, and the same is being done elsewhere in the world. Those candidate vaccines are safe. Those candidate vaccines are being looked for efficiency and efficacy. We are not allowing onto the continent any clinical trials that do not meet the global standards of safety and efficacy.
Lockdown measures have been implemented around the world, including in Africa. But we've seen in some countries that these measures have had a very, very terrible economic impact.
In the course of next week, we will release a guideline on easing the lockdowns. And this is necessary because one, Africa's economy is largely a daily bread sort of economy, where people must go out, they must work, and then they earn for the day. There's no reserve for most people in Africa. It is important that this is done in a manner that is good for the country, because you may end up chasing the economy, and COVID-19 devastates your workforce. So it has to be done in an incremental manner. Having said that, I must add that the effect of lockdowns is going to be seen in the next few weeks because the numbers are telling a story that it has not been rising fast. The numbers are telling a story that transmission has been slowed down. And this is important for Africa because our health systems are fragile and we cannot afford to have many people exposed and many people critically ill.
There is a concern that reallocation or allocation of resources to fight COVID-19 will put at risk the prevention and treatment of other diseases like malaria and measles. Is the Africa CDC ensuring that other diseases are still gaining the attention that they deserve?
From the very beginning of this outbreak in Africa, we have provided guidance to governments so that the normal health services do not stop. And key amongst those is that governments designate special areas, special facilities for managing COVID-19 cases, and the rest of the health system can be able to continue to do its work around the other ailments and the other conditions that the population is suffering from. We cannot afford to disrupt the normal health systems because it is a danger to society. If we disrupt it, then people will end up suffering and dying from other conditions, not just COVID-19. So our advice to governments is to not stop the other health services, continue with those, designate special facilities to look after COVID-19 patients, and in the planning, other health services must still be at the core of the provision of health services.